It's 3 a.m. again. You're awake. Sitting on the edge of your bed. You've already made 3 trips to the bathroom tonight, and now, something seems different. You noticed a faint pink color in your urine. Maybe it's nothing. Maybe it's just something you ate. But deep down, you know it's worth checking. If you're over 60, your bladder deserves attention. Not just because of age, but because of something far more serious that many people overlook. Today, we'll talk about a silent condition that affects over 80,000 Americans every year, many of them men and women over 60. Bladder cancer. In this video, we'll break down the early warning signs you should never ignore, who's at risk, and how to protect yourself before it's too late. Let's begin. Let's start with the basics. Your bladder is a small, hollow organ located in your lower abdomen. Its main job is simple: to store urine until you're ready to release it. But just like any part of the body, things can go wrong. Bladder cancer happens when the cells in the lining of the bladder begin to grow uncontrollably. These abnormal cells can form a tumor, and if not caught early, they can spread to other parts of the body. Most bladder cancers start in the urothelium, the thin layer of cells lining the inside of the bladder. This type is called urothelial carcinoma, and it makes up about 90% of all bladder cancers. There are also less common types, like squamous cell carcinoma, often linked to chronic irritation or infection, and adenocarcinoma, which develops from glandular cells. The good news: when caught early, bladder cancer is highly treatable. But the key is knowing what to look for, before it becomes a serious threat. So why does age play such a big role in bladder cancer? The truth is, most people diagnosed with bladder cancer are over 55 years old, with the average age being around 73. But why? As we age, our bodies go through many changes. Our immune system, for one, becomes less efficient. It's not as quick to find and destroy abnormal cells, like the ones that cause cancer. Over time, our body also accumulates more exposure to things that can damage cells, chemicals from our environment, toxins from medications or workplace exposure, even long-term irritation from infections or bladder stones. In men especially, the combination of aging, smoking history, and hormonal shifts can increase the risk significantly. And for women, symptoms are often mistaken for infections, which can delay diagnosis. That's why bladder cancer is not just a male disease. Women over 60 need to be just as aware. Knowing you're in a higher risk group means you can take action before symptoms become dangerous. Now that you know what bladder cancer is, let's talk about the 5 early warning signs you should never ignore. These signs often show up quietly, and many people mistake them for normal aging, urinary infections, or an overactive bladder. But in reality, these could be your body's first signals that something more serious is going on. Red circle 1. Blood in the urine, even once. This is the most common and earliest sign of bladder cancer. It may appear red, pink, orange, or even the color of rust. Sometimes the blood is so faint that it's only found through a urine test. And here's the most important part: it's often painless. So if you see blood even once, don't ignore it. Get it checked. 2. Frequent urination, especially at night. If you suddenly start needing to urinate more often, especially at night, take note. Seniors often assume it's just aging or prostate issues, but frequent urination can also be a sign of bladder irritation caused by a growing tumor. 3. Pain or burning during urination. Pain while peeing is often blamed on urinary tract infections, but if the discomfort keeps coming back, and antibiotics don't help, it could be something deeper, like a tumor pressing on the bladder wall. 4. Pelvic or lower back pain. As bladder cancer grows, it may cause a dull ache in the lower abdomen or back. Especially on one side. Many seniors ignore this pain or assume it's just arthritis or aging, but don't overlook it. 5. Feeling urgency even when your bladder isn't full. Do you ever feel the urgent need to go, but when you get there, only a few drops come out? That's a red flag. It may be a sign that something is pressing against your bladder or irritating the nerves inside. Don't just accept it as a nuisance. It's a symptom that deserves attention. While the early warning signs are important to catch, there are also a few later stage symptoms that often go unnoticed until the cancer has progressed. These signs may not seem connected to the bladder at first, but they can be important clues. Warning 1. Fatigue and weakness. If you're feeling exhausted all the time, even after resting, it might not just be aging. As cancer grows, it can interfere with your red blood cells, leading to anemia and chronic fatigue. Warning 2. Loss of appetite or unexplained weight loss. A noticeable drop in weight, especially if you haven't changed your diet, could be a sign that your body is fighting a hidden illness like cancer. Warning 3. Swelling in the feet or ankles. In some cases, bladder cancer can block lymph or blood flow, leading to fluid buildup in the legs. If your shoes suddenly feel tight or your feet swell without reason, don't ignore it. Warning 4. Pain in bones or pelvis. This is a late-stage symptom, but important to mention. If bladder cancer spreads to nearby organs or bones, you may feel pain in the hips, ribs, or pelvis. These symptoms don't always mean cancer. But when combined with urinary issues, they should never be dismissed. If you experience more than one of these, especially alongside blood in the urine, get evaluated. So who is most likely to develop bladder cancer? While it can happen to anyone, certain groups are at significantly higher risk, especially after age 60. Older adult 1. Older adults, especially over 60. As we mentioned earlier, age is the biggest risk factor. The majority of bladder cancer cases are diagnosed in people over 65. That's because the body's ability to repair damaged cells naturally declines with age. Cigarette 2. Smokers, past or present. Smoking is the #1 preventable cause of bladder cancer. Harmful chemicals in cigarettes are absorbed into the bloodstream and eventually filtered through the bladder, where they can damage the bladder lining. Even if you quit 20 years ago, your risk may still be elevated. Test tube 3. People exposed to chemicals or dyes. Long-term exposure to certain workplace chemicals, especially in industries like paint, rubber, leather, hairdressing, textiles, can increase your risk. DNA 4. Those with a family history of bladder cancer. If you've had a parent or sibling diagnosed with bladder cancer, your chances may be higher due to genetic susceptibility. Petri dish 5. Chronic bladder infections or irritation. People with frequent bladder infections, bladder stones, or even long-term catheter use are at a slightly increased risk. These chronic irritations may lead to cell damage over time. If you fall into one or more of these groups, it doesn't mean you'll develop cancer. But it does mean you should be more aware of symptoms and proactive about screenings. One of the biggest mistakes people make is waiting too long to talk to their doctor. Bladder cancer often starts silently, and when symptoms finally show up, they're easy to dismiss. But here's the truth, even a single drop of blood in your urine should never be ignored. You don't have to feel pain. You don't need to wait for the symptoms to get worse. If you notice blood in your urine, sudden urgency, frequent nighttime trips to the bathroom, or pain that doesn't go away, make an appointment. Your doctor can do something as simple as a urine test, or a painless ultrasound or cystoscopy to look inside the bladder. These tests are quick, non-invasive, and could literally save your life. And remember, early detection means high survival. Bladder cancer caught early has a 5-year survival rate over 70 to 90%. While we can't prevent every case of bladder cancer, there's a lot we can do to reduce the risk, especially after 60. These changes don't just help your bladder. They also protect your kidneys, prostate, heart, and immune system. No smoking 1. Quit smoking, for good. It's never too late. Within just a year of quitting, your bladder's risk begins to drop. And over time, your risk becomes much lower than someone who keeps smoking. Droplet 2. Drink more water. Staying hydrated helps flush toxins out of your body more quickly. Aim for 6 to 8 glasses of water per day unless your doctor advises otherwise. If your urine is pale yellow or clear, you're doing great. Broccoli 3. Eat a diet rich in antioxidants. Certain fruits and vegetables may help protect the bladder lining. Focus on broccoli, cabbage, tomatoes, berries, garlic. These foods fight inflammation and support cell repair. Test tube 4. Limit chemical exposure. If you work, or used to work, around dyes, solvents, or heavy metals, talk to your doctor. Use gloves, proper ventilation, and avoid contact where possible, even during hobbies like painting or home repair. Lotion bottle 5. Avoid holding urine for too long. Make regular bathroom visits. Holding it in too long can allow toxins to linger in the bladder and irritate the lining. Small daily habits can make a big difference. Protect your bladder now, and it may protect you for years to come. Bladder cancer isn't just about getting treated, it's about staying on top of your health for the long run. Even after successful treatment, there's a chance of recurrence, which means regular follow-up care is critical. Stethoscope. What does follow-up look like? After treatment, your doctor may recommend cystoscopy every 3 to 12 months. Urine tests to detect abnormal cells. Periodic CT scans or ultrasounds. These aren't scary, they're simply tools to catch any new changes early, when they're easiest to treat. Think of it this way, just like you check your blood pressure or monitor your sugar, your bladder deserves the same level of attention. And every clean test result brings peace of mind. Red Heart. You're not alone. Remember, many seniors live full, healthy lives after a bladder cancer diagnosis. With proper care, regular checkups, and a healthy lifestyle, you can too. Your health journey is worth every step. If there's one thing we want you to remember, it's this: bladder cancer is not a death sentence, especially when caught early. By staying alert to the warning signs, taking care of your health, and keeping up with regular doctor visits, you're already doing something powerful. You're choosing to fight for your future. Maybe you're watching this video for yourself. Or maybe for a loved one. Either way, you're not alone. Thousands of seniors are beating bladder cancer every year. With knowledge, action, and support, you can too. Take this message as a gentle nudge. If something feels off, talk to your doctor. If you're living with bladder cancer, stay strong. And if you're in recovery, keep going, you're doing great. Direct hit. Remember, knowledge is power. And you've already taken the first step, learning what to look for. Waving hand. Thank you for watching Urologist USA Today. If you found this video helpful, please, white heavy checkmark like. White heavy checkmark subscribe. White heavy checkmark share with someone you love. We're here to support your journey to better health, one video at a time.